Hello and welcome to the second episode of the Schizophrenia Treatment Exchange. In today's episode, we will be discussing the benefits, but also the risks of antipsychotic medication for schizophrenia. Now, we did talk about the effects of psychotherapy for schizophrenia in the first episode, and we looked at a clinical study that compared cognitive behavioral therapy for psychosis, or, if you remember, CBTP, to antipsychotic medication. We found that antipsychotic medication did tend to have more benefits than psychotherapy. However, this isn't always the case. Since schizophrenia is a very heterogeneous condition, antipsychotics can affect different cases in many different ways. Some people rely on their medication to get better, but some people claim that it makes their symptoms worse. So to really get an in-depth view into how antipsychotics affect schizophrenia, I have a real-life psychiatrist here with me today to help me out. So thank you for joining me, Dr. Natalie Shoham. I will be asking Dr. Shoham a series of questions on antipsychotic medication for schizophrenia, but we'll also touch up briefly on some of the psychotherapy aspects and CBTP in order to really reach that solid conclusion as to which treatment is truly best for schizophrenia. Okay, so my first question is the basics. Essentially, what exactly are antipsychotics?
So, antipsychotic medications are primarily used, as the name suggests, to treat psychotic illnesses. A psychotic illness which most people will have heard of is schizophrenia. Antipsychotic medications are usually given either as tablets every day or as long-acting injections which can be taken every couple of weeks or every month. It's worth mentioning that in the same way as aspirin can be used for more than one thing, like it can be used to treat a headache or to prevent a heart attack, antipsychotic medications also have multiple uses. For example, they are often used as mood stabilizers in bipolar disorder. They are also used, generally at lower doses, to help antidepressants to work in illnesses like depression, PTSD and OCD.
So how exactly do antipsychotics work?
Broadly speaking, all antipsychotic medications work by blocking dopamine receptors. And dopamine receptors, they receive a chemical called dopamine in the brain. For this reason, it probably wouldn't make sense to discuss how antipsychotics work without briefly mentioning the dopamine hypothesis of schizophrenia. This is the longest standing theory of how schizophrenia develops. The dopamine hypothesis posits that schizophrenia results from an overactivity of the brain chemical dopamine, particularly in certain circuits in the brain. Dopamine is a neurotransmitter which is thought to play important roles in learning, movement, motivation, experiencing reward and salience. And salience means knowing which stimuli are important to pay attention to. So theories of how schizophrenia develops tend to see overactivity of dopamine as a final common pathway. In other words, they suggest that this change from healthy brain functioning is present in many different people with schizophrenia and is a final cause of the illness. However, what led to this overactivity of dopamine might be different in each person. It results from a complex combination of things, which can include genetic factors and things in the environment like stress, discrimination, experiencing trauma, recreational drug use. So the precise cocktail of factors is different to or unique in each individual, even though many will have a change in the way dopamine functions.
So I understand that there are two types of antipsychotic. There's the first generation antipsychotic, which are dopamine receptor antagonists and are also known as typical antipsychotics, and they work by inhibiting dopaminergic neurotransmission. Apparently, they work best when they block out 72% of the D2 dopamine receptors in the brain. However, the antipsychotics don't just have dopaminergic action, but they also have noradrenergic, cholinergic and histaminergic blocking action too. So essentially they can alter the levels of the chemicals noradrenaline, acetylcholine and histamine. And then, of course, there's the second generation antipsychotics that work by blocking D2 dopamine receptors, but they also have serotonin receptor antagonist action, with the 5-HT2A subtype of serotonin receptors being the most commonly involved. So obviously the first and second generation antipsychotics work differently to each other, but are there any other main differences to them that you're aware of?
Well, You are right that traditionally antipsychotic medications have been divided into those two groups. As you said, the first generation or typical antipsychotic medications and the second generation or atypical ones. The classical difference in terms of their effect was supposed to be that they had a slightly different side effect profile. What this means is that traditionally we believed that the first generation medications had a greater risk of causing movement disorders, things like tremor, stiffness or shaking, whereas the newer second generation medications had a lower risk of causing those side effects, but a higher risk of causing other side effects, which could include weight gain and increased risk of diabetes and raised cholesterol. We're now realising that this distinction is perhaps not the most appropriate way to describe antipsychotic medications. The reason for this is that not every newer drug fits that profile, and not every older drug fits the profile I described before. Actually, you are very right that antipsychotic medications act on a range of receptors as well as dopamine receptors, and which ones they have the strongest action at varies between the different medications. So it's better to consider each medication in its own right.
Perfect, thank you so much. Okay, so my next question is, from what you've experienced as a professional, what are the benefits to antipsychotic medication?
So from what I've experienced as a professional, the good news is that many people do get better, at least to some degree, after starting an antipsychotic medication. In fact, it's thought from clinical experience and from research that at least 70 to 80% of people who have a first episode of psychosis do get better at some point. So that is very positive. And it's also generally accepted, although not everybody agrees, that antipsychotic medication is a significant part of the reason for this. Certainly not the only part, and there are many other things that are important in recovery.
Yeah.
But I think it can be a very important facilitator to recovery for many people.
Yeah, definitely. Yeah.
In terms of research, there was a 2019 study which was called a network meta-analysis, published in a Lancet journal. This was by Stefan Lucht and colleagues. They found over 400 studies looking at 32 different antipsychotic medications. They said that all of the antipsychotic medications reduced the symptoms of psychosis compared to a placebo, although for a few, the statistical evidence for that wasn't strong. All antipsychotics, looked like they reduce the symptoms, and they also published a 2017 review which found that approximately twice as many patients improved with antipsychotics as with placebo in clinical trials. So with the exception of a medication called clozapine, which is more effective than the other antipsychotic medications, there is generally considered to be not that much difference between the medications in terms of how effective they are at treating the illness. However, they certainly differ in terms of their side effect profiles. So for this reason, when I see people who are interested in starting an antipsychotic medication to treat something like schizophrenia, I usually ask them to look at a chart of the different side effect profiles of the medication and then try to choose one together based on the potential side effects and which they think they would manage best with. So, for example, some people would be very distressed by gaining weight, understandably. In that case, we would try to choose one with a lower risk of weight gain. On the other hand, some people want a medication that will help their sleep if they're having a lot of difficulty sleeping. So we might try to choose something together which causes nighttime sedation to help that sleep. Then again, some people might need a monthly injection because it's very difficult for them to remember to take daily tablets, and then that limits the choice to medications which are available as an injectable form.
Yeah, so I actually read the same study published in 2019. Like you said, clozapine was the most effective antipsychotic, but there were a few others that were also very effective, including amisulpride, zotapine, olanzapine, and risperidone. However, this doesn't mean that the drugs will work for everyone, but according to this study specifically, they have more of a chance of being beneficial. So I think another important issue to address is the kind of antipsychotic that is administered. So have there been any antipsychotics that you tend to administer more than another, or does that tend not to happen since schizophrenia is such a heterogeneous condition?
Well, as you mentioned, there are some that might be slightly more effective than others, even though the differences are not that great. So if somebody didn't get better with the first medication, it might be worth considering one of those. Then, as I said before, we might tailor the side effects to the person, and as always, that is best done as a joint decision between the prescriber and the person experiencing the symptoms. We might be guided by some other things as well. So, for example, if somebody's mood is low, we might try to choose an antipsychotic medication that might have some mood stabilising properties. Personally, because weight gain is a very important side effect that many people want to avoid, if there's not anything else to steer me away from this, I will always try to start with an antipsychotic medication that has a lower risk of weight gain. But some psychiatrists might take a different view and prioritise, perceived effectiveness or the need to help sleep, for example. A particular problem is that, generally speaking, antipsychotic medications don't tend to work as well for the so-called negative and cognitive symptoms as they do for what we call positive symptoms. And just to be clear, positive symptoms are things like hallucinations, seeing something that's not generated by a real stimulus, or delusions, which are beliefs that are very firmly held, that other people find very hard to understand and don't make sense in the context. On the other hand, negative symptoms mean the removal of something that would normally be there in health. So that might be loss of motivation, loss of energy, loss in the normal ups and downs of mood that we all have, or loss of concentration. And unfortunately, these symptoms are very frequently part of the illness as well. We need better treatments for these symptoms. Even after the positive symptoms, like the hallucinations, for example, have gone, it can often be these symptoms which prevent somebody from doing the things that they really want to do, like getting back to their work, their friendships, their hobbies. And as I say, this is a real problem. So I certainly hope to see better treatments for negative symptoms in my career. It is widely believed that abnormalities in the functions of other brain chemicals besides dopamine might be responsible for the negative symptoms. Glutamate is of particular interest, but to my knowledge there are no treatments for that at the moment. I have seen that there is a new medication called CAR-XT which is in clinical trials at the moment, which works by activating acetylcholine receptors in the brain. So that is a completely different mechanism from the medications that we use now. And my understanding is that it's still too early to say whether this will be useful in clinical practice, and more research is needed. However, the preliminary findings are quite promising, so there could potentially be some exciting developments in future.
So, I think one of the most important questions to ask is, why might antipsychotics be harmful for some patients? Is it to do with the side effects, or could there be other factors involved too?
Unfortunately, antipsychotic medications have quite a range of side effects which can impact on quality of life. And this is quite frequently a reason why people understandably decide not to take them, even if they have helped with the symptoms of the illness. I will discuss just some of the more common and some of the more problematic side effects. So firstly, as well as being a crucial component of the brain pathways that I mentioned are responsible for things like motivation and learning, dopamine is also key to another brain pathway which is responsible for coordinating smooth movements. For this reason, as I alluded to earlier, antipsychotic medications can cause movement side effects. These can range from things like stiffness and tremor to, in more severe cases, a sort of freezing of a group of muscles called dystonia. And this is a really unpleasant side effect, and one that's important to treat quickly. Fortunately, this is quite rare. The good news is that we now know that movement side effects tend to relate to the dose of the antipsychotic medication. So the doses that we use now are lower than the doses that were sometimes used historically, and this means that we are more likely to be able to avoid these side effects now when prescribing. We don't always manage to avoid them for everyone, but it is fortunately less frequent. If this occurs, these movement side effects, then options might be lowering the dose of the medication or changing to a different medication, which is less likely to cause the effects. We also sometimes add in another medication which can actually treat the side effect whilst continuing the antipsychotic medication if it's working well for somebody in terms of treatment. Another common side effect, which I have already mentioned because it's so problematic, is weight gain, which is more of a problem often with the newer medications, but not necessarily with all of them. Of course, if somebody gains weight, that can have a negative effect on their confidence and their body image, and very importantly, it can have implications for their longer-term health. Along with weight gain, some antipsychotic medications can increase the risk of diabetes and of raised cholesterol, and this in turn can raise the long-term risk of cardiovascular disease. This is absolutely crucial, as cardiovascular disease is sadly a leading cause of death in people with serious mental illnesses. However, I do think it is very important to mention here that actually having an illness like schizophrenia in itself does seem to increase the risk when no antipsychotics are taken as well. So it's not always clear how much of the increased risk is actually due to antipsychotic medications. The best case scenario is that treating the illness might help someone to regain their capacity to look after themselves by eating well and exercising. So may even improve the situation. But as I say, some medications do clearly increase the risk of these side effects as well. If weight gain occurs, the options might be to switch to a lower medication that has a lower risk of causing weight gain, and that's often a very good option. Some people just manage to avoid or counter the side effect through proactive lifestyle choices, but I don't think we should underestimate how difficult that can be, particularly when you're unwell, and not everybody is in the fortunate position where they're able to exercise regularly, for example. I think if anybody is taking an antipsychotic medication and is worried about weight gain, it is very important to speak to your GP or your psychiatrist. One reason for this is it's very important that anybody with a diagnosis of schizophrenia or another more serious mental illness should have their health checked once a year. This is sometimes done by general practitioners in the UK and sometimes by community mental health or hospital teams, but it should absolutely be offered to everybody so that hopefully if there's an increased risk through high cholesterol, for example, something can be done to reduce that risk. And sometimes, again, GPs may even be able to add in medications to counter weight gain. So it's not something that we should, think that we can't help with. It's very important that you seek help if needed. As I mentioned, most psychiatrists will try to choose medications that don't increase weight if they're able to, or maybe less likely to. So other side effects which cause people, real difficulty can include tiredness. And whilst that can be beneficial if it helps with insomnia, it's obviously not a desirable side effect if it continues into the day and affects someone's productivity. And nobody wants to feel tired. Again, that might be a case where you would need to consider switching to another medication that's less likely to cause that side effect. I think it's worth mentioning that it's not uncommon, unfortunately, for people to have sexual side effects, like loss of desire, for example. And sometimes people are too embarrassed to talk to their clinicians about sexual side effects, but they are, not uncommon. They are important in terms of quality of life, and there are things that can be done to try to address those. So again, it is actually quite important to speak up if that's a problem. I think there might just be a couple more things to say on the subject of side effects. So firstly, antipsychotic medications can sometimes have rare but really serious side effects. So anyone who feels suddenly very unwell after starting an antipsychotic, particularly if you have symptoms like fever or sudden stiffness, should seek urgent medical attention. So fortunately, although dangerous, those side effects are rare.
Yeah.
And I think the last point while we're talking about side effects is I just wanted to say, for anyone who's considering stopping antipsychotic medications due to side effects, I would encourage those people to speak to their clinicians about it if possible. There may be, there are some people for whom, unfortunately, it's not advisable to stop, but there may be other options like changing medication or reducing the dose. And if you do decide to stop, which is a very valid choice, it's nearly always safer to do so very gradually by reducing the dose carefully over months, with the exception of a side effect that's dangerous or that somebody really can't manage. It's nearly always better to do it that way. And that's because stopping gradually and with support from a clinical team increases the chances of that person staying well without the medication and increases the chances that stopping will be successful. So if you're thinking of stopping antipsychotic medications, the doctors who work with you or other healthcare professionals who work with you should be able to offer some advice on that. There are also some resources available, for example, on the Mind website that give advice about thinking of stopping antipsychotic medications.
Great. It's also an issue considering the physical side effects can also have psychological impacts, such as the weight gain and the tiredness as well. Have you seen much of that when tending to patients?
Yes. So recovery used to sometimes be talked about in terms of just reducing the symptoms.
Like psychotic symptoms,
yes. But increasingly it's recognised that recovery means far more than that. For many people, recovery might mean, resuming their friendships. It might mean starting a family. It might mean going back to work. And obviously the last thing that we really want is for somebody to be so tired that they haven't got their productivity and they're not able to focus on those things. And again, depression can occur not infrequently in people with psychotic illnesses. And I think that's just one other reason why it's very important that these decisions about medication, where possible, are made collaboratively between the prescriber and the person taking the medication so that we get it right.
Yeah, definitely. Okay, thank you so much. So I actually found this paper online. It was essentially about this study where 832 patients filled out a questionnaire, and it was a questionnaire that recorded their experience with antipsychotic medication. This questionnaire was completed by users from about 30 countries, but predominantly focused on the USA, the UK, and Australia. Now, to give some statistics, over half, so 56%, thought that the drugs reduced the problems they were prescribed for. So here we're talking about these psychotic symptoms like hallucinations and delusions, but 27% thought that the medication made them worse. 41% of the people found the drugs generally helpful, while 43% found them unhelpful. And while 35% reported that their quality of life was improved, 54% reported that their quality of life was actually made worse. Now, you may be thinking as an audience, why have over half of the users said that the drugs reduced the problems they were prescribed for, but why did half also say that their quality of life was reduced? Well, like I said, the symptoms that they're referring to are the symptoms of psychosis. And although these symptoms can be reduced by the antipsychotic medication, other side effects can kick in from the medication that can ultimately make the quality of life worse. And just because the psychosis symptoms are alleviated doesn't mean that other symptoms will be. So, Dr. Shoham, what is your input on this paper?
So there are certainly some things that are highlighted in this paper that are concerning. One, obviously, is the very high proportion of people who report problematic side effects or report that they believe their quality of life is now worse. I think it is important to note that this wasn't necessarily a sample that's representative of everybody with a psychotic illness. This was a sample that was drawn from advertisements on social media and from a marketing company and from asking people to essentially invite their contacts to take part. The authors say that they believe their sample had a more positive experience with antipsychotic medications than average, but I think it's very reasonable to suspect that it was probably people who had an experience that was more extreme in either direction who responded. So I don't know this for certain, but I would guess that people may have been more likely to respond to the survey if they had either a very positive or a very negative experience. So to really know how many people think that the medications made their life worse, we'd have to try to sample, everybody within a certain area or over a certain time period, or think of another way to do it. I think one or two things that were very concerning from this study were the fact that a very high proportion of people said that they hadn't been informed of the side effects. Now, the ethical guidance for anybody prescribing medication in the UK would be that they should try to give a balanced account of what the medication is likely to do so that people can provide informed consent to it. Of course, if somebody is very unwell at the point that the medication is started, for example, to the point that they're not able to process information and in hospital, then that might be one reason for not being informed about the side effects at that point. but efforts should still be made to have an open conversation with them about that later. So that is concerning, and perhaps suggests a need, to remind people about the importance of informed consent. Another very concerning thing from the paper was that the authors reported suicidality as a common side effect. I think they gave a very high figure of over 50%. Now, I agree with them that needs to be taken very seriously, and it strongly suggests that perhaps when medications are being trialled in future, suicidality, which means, thinking about suicide or even worse, actions with the aim of suicide are, that they should be asked about in studies. But I also do want to try to provide a little bit of reassurance here so as not to alarm people. And I'd like to reference a 2015 study by Torniainen and colleagues, which sampled more people, thousands of people with schizophrenia, because this study showed that the highest risk of death by suicide was in people who had never taken antipsychotics. And it's worth mentioning that clozapine, for example, is believed to have an effect of lowering the risk of suicide. So I think there's certainly plenty of evidence out there that treatment can actually help with that. And the reasons why people reported that in the study need a little bit of consideration.
Yeah, I think I mentioned in the first episode that I think I mentioned a statistic of 50% of people with schizophrenia will have suicidal thoughts and 10% of those people will act on them. But I have read papers where antipsychotic medication is thought to decrease this statistic, like you said.
Yes, and as I say, that paper had a larger and more representative sample, so hopefully provide some reassurance.
Of course, yeah.
Of course, this is potentially a very upsetting topic for people. And I'd just like to say, whilst we're talking about this, that there are plenty of places where you can go to seek help if you feel in danger from your mental health in any way. Yeah. That could include local crisis line services, the new option of NHS 111, and then option 2, organisations such as the Samaritans. So, there are plenty of places where people can go.
Yeah, definitely. So this is my final question. It's basically the whole reason that I'm doing this podcast. Do you think that there is more success when antipsychotics are used in conjunction with CBT? Are they better alone? What are your thoughts on that?
So firstly, I think we are fortunate to have both available in the NHS, although there is unfortunately a longer wait than we'd like for these sometimes. I'm personally not a therapist, but I do refer plenty of people who I see to my colleagues who are therapists and work with them. I think therapy has a very important role in the treatment of psychotic illnesses, often alongside medications. So you'll probably be aware now that it's recommended that people with a first episode of psychosis are offered cognitive behavioural therapy, or CBT for short, in our guidelines, the NICE guidelines.
Sorry, what does NICE stand for again?
It stands for the National Institute of Clinical Excellence.
Okay.
And it publishes guidelines on a whole range of medical conditions.
Of course,
based on the latest evidence.
Perfect.
That are widely followed by healthcare professionals.
Okay, yeah.
I've also come across a recently published Cochrane review, which aims to summarise all of the evidence. This found that CBT delivered face-to-face in groups in early psychosis reduced symptoms compared to treatment as usual, but it commented that the certainty of the evidence needed improvement. There's also a real-world study which followed thousands of people prescribed antipsychotic medications, and this showed that the more effective of the medications reduced the risk of being hospitalised by about half over more than 10 years compared to no antipsychotic medication. So it's fair to say that the evidence for the effectiveness of antipsychotics is quite strong, and we still need a bit more evidence for some forms of cognitive behavioural therapy. But nevertheless, many people I see very much value their therapy, and I think that is quite telling, just based on clinical experience. It's worth noting as well that when there have been trials of individual cognitive behavioural therapy and psychosis, they usually compare cognitive behavioural therapy and medication compared to just medication. So they're not directly comparing medication and therapy, but they find encouraging results often for cognitive behavioural therapy alongside the medication. from an individual perspective, I think which one is best is determined, as always, by the choice of the person who's affected and individual circumstances. So occasionally somebody might be too unwell to really make the most of therapy when they're first seen, and they might need a bit of time and medication to improve to the point where they can engage with and make the most of the therapy. And on the other hand, I see people who are understandably reluctant to take antipsychotic medications, but they are very happy to speak to a psychologist to work through their problems. Sometimes they actually come to the decision to give the medication a go after talking about it in the therapy. And of course, some people, get better with no medication. So although I do think there are some people who certainly do need to take antipsychotic medication for a prolonged period to stay well, there are some people who seem to do fine without it as well. There's a huge variety. As always, if you think that you'd like to pursue either of these treatments, it's worth speaking to your clinicians about it. It is worth mentioning there was also a Lancet review which found that the odds of relapse were reduced by about half after 12 months of having cognitive behavioural therapy for psychosis.
Wow.
So again, that's very encouraging.
Very promising.
Very promising. But the trials in that study were, again, comparing people who had CBT with medications and just medications. And what we don't necessarily have so much evidence for is whether the effects of CBT last longer than 12 months.
So what Natalie has said here sort of wraps up this episode. We can conclude that since schizophrenia is such a heterogeneous condition, treatments will differ. But in the end, the patient has complete free choice as to what treatment they would prefer. Most studies have said that antipsychotics are more efficacious than CBT. So, like Natalie said, more research into the benefits of CBT need to be done. Therefore, antipsychotics have been proven to be clinically better, but the benefits of both antipsychotics and psychotherapy depend on the patient. A patient may prefer one over the other, or even both together. Thank you so much for listening to this episode and sticking out right till the end of this podcast, and especially thank you to Dr. Natalie Shoham, who has joined me today and provided us with all of her wisdom and knowledge. To my listeners, it means so much to me that you listen to the Schizophrenia Treatment Exchange, and I really hope you enjoyed every minute. And finally, please always remember to support those who are struggling, not just from schizophrenia, but from anything whatsoever, whether it's a mental health issue or a severe mental illness, and always listen without any judgment whatsoever. Again, I am so thankful to all of you for listening, and hopefully I'll see you again soon. Bye!